All right, everyone. I am going to go ahead and kick us off. I think we had a really nice response to this, so I would anticipate people will be filtering in. Welcome today to this webinar. I'm Dr. Bonnie Clipper. I'm the CEO of the Virtual Nursing Academy, and I'm really excited that we are here to talk about Beyond the Buzz, AI and robots in healthcare. And just a couple housekeeping things. If you have questions and if you wouldn't mind dropping those into chat, they'll be filtered to Dr. Thomaz and myself, and we will get to those at the end. So we do want to make sure that we save some time. We did receive some questions in advance as well, so we will be discussing those today with you. So welcome everybody. We're excited to talk about AI and robots in healthcare. And today we're going to spend a little time going deep on nursing and technology, really thinking about the benefit and the potential that AI has to support nurses. So certainly, nursing is one of my passions, and I think it's incredibly important that we think about all of the healthcare disciplines, but nurses are really key in thinking about technology. This is a really very exciting time for us, not just across the different disciplines, but really in nursing as well. So we're at kind of this pivotal moment with a lot of real cool things that we can do in our profession. And we have a lot of work to do today and a very densely packed session with you. So it is my privilege to introduce my friend and colleague, Dr. Andrea Thomaz, the CEO of Diligent Robotics and a leading researcher in AI and robotics. So, Andrea, I'm going to hand it to you
Thanks,
to
Bonnie.
introduce yourself.
Yeah, happy to be here. Like Bonnie said, this is a really exciting conversation. I've been looking forward to it. I'm Andrea Tomas, CEO and co-founder of Diligent Robotics. But I'm a roboticist, so I'm coming to the robots and AI side of this equation and this discussion today. Actually, got my PhD in AI-powered robotics from MIT, and then was a professor teaching robotics and had a robotics lab at most recently UT Austin. And what I'm really passionate about with robotics is the field called human robot interaction. So really thinking about what does it take to put robots right next to people and have that interaction go well. And so I think that's where I think it's really interesting to think about robots and AI fitting within a healthcare setting. The key piece of it is really, how are we integrating seamlessly and effectively into the human world that healthcare is always going to be based on the patient and based on the humans that are taking care of that patient. So I think that's one of the themes that you'll hear from Bonnie and I today. Um, I guess the other thing I'd say by way of introduction is just that Bonnie and I have known each other since the very first days so I launched Diligent Robotics in 2018, and Bonnie was one of the very first people that I ran into that started to introduce me, a roboticist, into the world of nursing and hospitals. And we had, my passion was to bring this research and start having it impact real people in the world. And no better place to start than trying to impact nurses and the important work that they do. So, Bonnie and I go way back, and we're excited to continue this conversation today. So, I think
And we don't
oh,
need
go
to
ahead.
tell them that we were sitting outside a Mexican restaurant, maybe with an adult beverage, and Moxie was a
Yes,
napkin drawing at that time.
exactly. Yeah, it was a great South by Southwest meeting. Okay, so we had, like Bonnie said, we had a lot of questions come in, so we sort of arranged a couple of topics that we'll run through before hitting up the kind of real-time questions that you guys might put into the chat. And we have some folks monitoring those, so definitely send them over as they come up for you. But the whole premise of this was that Bonnie and I get regularly asked, like, "Hey, is this really happening? Is this real? I saw this thing, this robot or this AI or this software. What do you think? Should I be thinking about this?" And so, Bonnie, do you want to talk about some of your myth versus reality? What are some of the perspective that you have there?
Yeah, absolutely. Thanks, Andrea. I think it's really important when you begin thinking or talking about AI is separating the myth from the reality. And certainly we're not talking about the Terminator here, but rather we're talking about how do we use technology that's going to be beneficial and it's actually going to assist us in providing patient care. So I think the first thing that's really important to know is that AI, artificial intelligence, augmented intelligence, is not intended to be a replacement for what nurses do. I know oftentimes that's something that gets a lot of hype and a lot of press. AI is not going to replace nurses. It is certainly going to allow us to think smarter and more accurately and faster and make better decisions. It's going to reduce our cognitive load. It's going to help us reduce errors. It's going to speed up the way that we care for patients, not in a speed it up to replace nurses kind of way, but help us make those decisions in a way that certainly improves outcomes for patients. And I can give you an example on that. There are already a couple really powerful AI related products in the market that are really doing a lot of work. It's kind of as though you would think about some of those early warning systems that use algorithms to detect patient changes and looking for patterns and trends to allow us to do something different to intervene for a patient situation before it becomes an emergency. So algorithms have been around for 15 years. Muse, right, the medical early warning systems have been around for over 10 years. So some of that is not new. What's new is the continual learning, the machine learning processes, and literally making technology smarter and smarter, which is going to help us as nurses, as nursing professionals, do a better job caring for our patients. What's fascinating to me, Andrea, is that McKinsey and the American Nurses Foundation did a really great study, and you can search for it, and it's very, very well done. And there were a couple questions in particular, I think, that are very helpful for nurse leaders or for nurses to pay attention to. They asked the question about what are the top three concerns about AI in healthcare. And of the nurses that responded, it was a very healthy sample. 61% said trust in the product, trust in the algorithms, trust that it's going to give the nurses the right kind of information to do something with. The second concern, 49%, were actually thinking about what is the impact of AI and how will it reduce the interaction with the patient? So human interaction. And the third top concern at 36% was a lack of knowledge on how to use AI. So we're going to dig in a little bit throughout this discussion into these separate pieces, but I thought that was a really good place for us to start. So again, I would just suggest to everyone, and we can even attach it to you for you later, but this McKinsey study is very well done and it's got some great information. Andrea, I'm
Yeah.
wondering what some of your thoughts or even some anecdotes or feedbacks that you might have received about how we're going to intersect from a patient care and nursing perspective and AI.
Yeah, I think it's that trust factor is huge. And I think that's where, I always think about it from the robotics perspective. So the physical AI. And when we're thinking about our Moxie robots are doing transport tasks, so bringing lab samples, medications, lightweight equipment, and things that are supporting the clinical teams. It's very much the trust factor are some of the things that we get the most feedback about. Like there's something about being able to just request a pump that is going to be coming down from central supply, and you don't have to think about it again. It's just going to come in a 30-minute time window or 40-minute time window, whereas previously maybe you had to keep that cognitive load and at top of mind, and you were always having to like call back down, like, hey, are you bringing me that pump? And so I think those are some of the things that we can start to reduce the number of little tasks that the clinical teams are having to think about. And that's the kind of value of AI, both software and physical AI, is to get rid of some of the tasks and let nurses and clinicians focus on the patient. And so, like, I think you were talking about the worry being, is it going to reduce the time that people are spending with patients, I think the hope is that it's increasing the time that nurses are having with patients.
You know what I love about this point that you've made is this isn't a binary choice. It isn't either high touch or high tech. It's both. It's an and.
Hmm.
So I think what you described around using the AI as a tool, when done well and when done right, this should allow our nurses to spend more time with their patients and less time on some of those tasks and that functional work they're doing now.
Yeah, absolutely. And I think that's part of when we think about the beyond the buzz and the hype, some of the things that get a lot of traction and news is when it's a little too overblown about AI is going to do everything or robots are going to take over this entire category of work. And it's not going to be my prediction is it's not going to be anything like that. It's going to be we're going to slowly decide how robots and AI should fit into workflows, especially clinical workflows, and do it very thoughtfully in ways that make sense for people and the patient. Because in the end, as hospital leaders are always putting the patient first. There's, that has to be the center of what's happening. And so, I think that we're going to see the most benefit from really kind of diving in and picking those very specific workflows that are most impacted.
And I think this is a really important point because there's a lot of emphasis right now on care transformation. So we spend a lot of time working with organizations to think through who should be on the care team. Do you have the right people there? Are they performing the right function? Should you be adopting a virtual care model? One of the things that's always funny to me is that when people start looking at who's on the care team, we immediately assume that everyone on the care team needs to be a human.
Hmm. Yeah,
And
I
I
think
think
that we're
that's not
seeing a
true,
lot of,
right?
yeah, I think we're seeing a lot. Personally, I'm having a lot of conversations with super innovative healthcare teams and leaders, and they're asking that exact question. They're saying, okay, if I have virtual nurses and, physical care team members on site, yeah, I am going to need more automation to support those physical care team members who are on site while the virtual team members are supporting as well. So there's a role to be played and it's a clinical skill mix that I think we have the opportunity with these new tools to really rethink that. And it's exciting. And it's one I think that's really exciting for nursing. And I'm curious what you think, Bonnie, but there's an opportunity for nursing to really drive this and say, actually, here's how we think this should best apply across and to support the care team.
Well, of course, I couldn't agree more. And I think that in healthcare and nursing, we are extremely entrenched in our ways, and change is very difficult. And in fact, sometimes we even find that the incentives are perverse, right? So we talk about value-based care, yet hospitals make their money still by having patients in beds. So when we think about where care is going, nurses do have to drive that. That means that we also have to equip them with the skills, the information, the knowledge that they need. And this paradigm shift is huge, Andrea. You're talking about us going from being the Flintstones to the Jetsons, right? That
Yeah.
takes time. That's going to take a lot of effort for us to do that. So if we were to pivot on this a little bit, when you think about, upcoming advances in AI and things that really can be very adaptive and make a change in terms of the patient care environment and where we're going, whether it's robotics or whether it's using more artificial intelligence in the platforms that we have, what does that look like to you? How do we begin to improve workflows and the outcomes that we're having as well?
Yeah, I think that it's really exciting to see how we can use these new next generation AI models and the like mass amount of data that they can take in, model, and then use. What that means for robots like Moxie robots that are running around hospitals is being able to perceive the world in a more granular way, being able to incorporate more data from the history of the whole interaction that these robots have had in the environment to be able to make smarter decisions. So is it, that I can, predict that this is going to be a busy hallway, and so I'm going to take a different hallway because I'm looking at all of the data from going down these hallways for the past year. Um, Being able to reason about the dynamics of the environment. So, we're seeing major advances in Moxie's ability to, navigate in a busy elevator or busy elevator lobby, and being able to, now ask people for help or say, "Hey, I'm going this way. Can I get in that spot for you?" So having that kind of more high end patient facing interactions, those are going to be ones that are going to be very exciting to start to see, kind of the interface that people are able to have with the data is just going to become more natural. And that's where I think it really is important for us to think through where's the right place to put that. How do we ensure that people understand the data that that model has been built from, and they can have trust in the data that a model has been built from. So those are, we got back to the kind of trust factor quite a bit.
Yeah, what's really interesting is, again, going back to this McKinsey and American Nurses Foundation study, when really trying to understand what would make a difference from a nursing perspective to understand and trust AI. Certainly, one of the things that came up is having nurses or nursing experts be involved in the development, the design, the governance, the oversight of these technology platforms, devices, and tools. So, in this question, which was literally when asked what's most needed to alleviate concerns and build trust, 73% of respondents suggested having nursing input into the design and development is key. And at 69%, the next two responses came in, and that was the evidence of the AI being effective from a quality and patient safety perspective and clear guidelines on when it should be used. So those are really important things for us to think about as we're trying to build trust from a clinician or nursing perspective. How have you seen
Yeah.
that apply in kind of the robotics world as well?
Yeah, I was just going to say that really resonates with the change management that we have to do when we're introducing robots into a new hospital environment. Because you're, by definition, you're changing the clinical workflow. Say I'm a nurse and I used to have to go to Central Tele and get my tele boxes. And now, Moxie's going to do that. But we have to decide exactly how, exactly who's going to do what. There's, what the teletech's going to do, what the nurse is going to do, and what Moxie's going to do in between. And getting that workflow right is what really matters in how effective that automation can be. And it's as simple as like, well, who's going to request the robot? And is the robot automatically going to show up? Or there's a lot of details that have to be worked through. And what we found the most important part is to, one, involve nursing in the full design of that workflow. And be willing to go back after the fact. So there's a lot of times that people think they know what the right workflow is going to be for automation, and you go and design it, but we've found that we gain a lot of trust from people when you're, willing to, okay, been doing this for 2 months, anything you would change about this? And then people often have ideas. And I would say nursing is often surprised, I think, that we have a technology that we're able to sort of change a little bit and like take that feedback and change. I think we find that nurses are much more used to, figuring out the workaround to a technology that's been introduced in their workflow. So I think that kind of being flexible and able to kind of take nursing input, try something, iterate, try it again. Because like you said, this is Flintstones to Jetsons. We're not going to get it right the first time. And so, implementing continuous improvement is the way to build that trust, I think.
Now, one of the questions that we received in advance is a really great question, and that is kind of exploring and sharing some of the most common use cases that we currently see AI utilized as a tool. So, what's great about the question is that oftentimes we go to the most complicated and complex things that AI could be used for, where we're really seeing this almost the foundation being built are things that I would say are low risk from a patient perspective. So looking at billing, coding, pre-authorization, AI is exploding in those areas, and it should. It can
Yeah.
happen so much faster. And what we're seeing in some organizations is that as we're able to offload that literally task-based work, what we can do is free the humans up to then teach them and train them how to be clinicians. Is this somebody that wants to be a nurse? Is this somebody that wants to be a scrub tech? So I think there's a lot of opportunity with that patient scheduling to optimize OR and procedural areas, staff scheduling, and using the predictive tools that exist today to predict staffing on any given unit, not only in an hour or two or four, but for tomorrow or the next day. So those are examples that aren't even high risk from a patient care perspective. I'm wondering what you have to share for those.
Yeah, that's it's so interesting. I would say there's the exact analogy in robotics where you've got a lot of excitement around humanoid robotics, and that's the very end game of of AI powered robotics are general purpose humanoids that are you know doing your dishes at home. So that is very exciting. But I think what we are seeing and what we'll continue to see for a long time is that, there's a lot we can do with robots in healthcare, in hospitals, in care spaces before you go all the way to that general, like completely general purpose humanoid. So, for example, Moxie is a wheeled robot with an arm that can manipulate and manipulate the environment in a task specific way, but in a way that's kind of general to any environment. And that's the kind of general purpose that's going to be really the sweet spot for physical AI for a long time. And, similar to kind of the billing type tasks, we're not going to see robots take over everything or entire clinical workflows. Like, we're doing transport tasks between a lot of different departments. And it's kind of as boring as billing, right? But it gets the job done. And it's like that back office stuff that really takes things off of people's plates. And it's really where you get a lot of buy in from the clinical team because every person that you ask, like, hey, do you want to be running to the lab when your lab sample can't go in the tube system? They're going to say, no, I don't want to be running to the lab. So I think to similar to the applying AI in the kind of back office systems where it really makes sense and it takes that time and really gives it back
Mhm.
to a person that you can do something better with that time. I think we're going to see this very same thing in robotics. And we're just kind of scratching the surface on what those support tasks are. I think there's so many more than the ones we're doing today. But yeah.
So, what I would like to hear from you, Andrea, is if my organization is interested in pursuing a robot, what is the return on that investment? How do we begin to look at that to build a business case?
Yeah, it's a great question. So I think there's two ways that we're seeing our our partners are sort of there's like two levels of return on investment that we can start to think about. One is that direct I don't have enough pharmacy techs or I don't have enough lab techs and I need more people because we have so many things that we have to get around this hospital. And so you're truly augmenting the workforce and you see that as a financial return on investment. And the second piece, though, I think that you're seeing more people really start to try to quantify. It's a little bit harder to quantify, but there's a way to really look at how automation is impacting patient care, patient safety, all of the quadruple aims that hospitals are focused on. Because the same reason that you automate a factory is why you want to automate in healthcare. You want to get high quality repeatability. You want every patient to have their, labs delivered as fast as possible. You want every patient to have their discharge medications as quickly as possible. And you want that to be a consistent, high quality experience that every patient is having. So I think that's the promise and the ROI of automation. And so I think that's where we're going to start to get that. The other one, I have a story of a one of our um, one of our hospital partners actually is doing some research on the impact of their robots on their clinical teams, and they're seeing that it's having staff satisfaction and job satisfaction is a big focus for a lot of hospital leaders. Like, how satisfied are people in their work? How joyful is it to be at work? And that's one where they're seeing that people who use Moxie in their role are seeing the value of Moxie, and they are seeing that as a positive outcome on their work and the kind of quality of their work. So we're
I
expecting
love that.
that we'll
Thanks.
start to see more and more of that.
Well, and I think that that says a lot in terms of how Moxie's incorporated into the team. So that's very cool.
Yeah.
We did get a question about virtual nursing and how does that fit into the care models of the future. In my opinion, we are evolving pretty quickly. I think what we're seeing now this year, 2024, is very different than what we saw. Virtual nursing has been around since 1995. So we continue to evolve thanks to the pandemic for really providing the springboard for this to leap forward. In my opinion, because of the good outcomes we're seeing in reducing length of stay, readmissions, improving HCAHPS, reducing turnover, reducing rapid response codes. I think that this is going to become the standard of care in probably the next 5 to 10 years. And what that means is that organizations that have it are going to continue to click along, going to be efficient. Again, that does not mean fewer nurses. It means nurses will be spending the time with the patients that they don't have today. And I also think it's going to be an attractor in terms of recruitment and retention, where organizations that don't have those extra eyes and ears to support the nurses, I think that is going to be more of a challenge. What's interesting too is imagine the world where Moxie could be summoned or called upon by the virtual nurse to help the bedside nurse. What could that look like?
Yeah, I mean, we're actually looking at doing some pilots with that kind of a care model exactly. So, I think it's definitely the future of looking at all the ways that the virtual nurse can have more impact in the physical space, either through logging, jumping onto a camera and having a virtual interaction with a patient, or sending something to the patient with a Moxie. So I think it's going to be great. There's another question that came through that I wanted to get your take on, Bonnie. People are asking, what should healthcare leaders be doing to stay on top of this and to stay on top of all of what's happening in AI and robotics? What would your advice be to those leaders?
Yeah, I love this question. So from my perspective, I think this is a total opportunity, right? And again, it doesn't always mean you're going to like every piece of this, but it's an opportunity. Be a sponge, learn as much as you can, get involved in any and every pilot opportunity, really get to understand how the technology works and maybe how it doesn't work. And as you begin to build those relationships, not only with vendor partners, but also on these kind of teams that are going through the planning and implementation process, that's really where we as nurses can sort of double click and start to say, hey, I would like to be involved with this way back at the beginning in the design and development stage, not just, hey, will your unit pilot this after it's already kind of been evolved.
Decided.
So I
Yeah,
think as nurses, our chance here is to really raise your hand and go way back to square one and say, how do I get involved in this? It's good not only professionally, I think it's going to be great for the organization. We have to have nurses designing this changing workflow process.
absolutely. So I would add on the robotics side of things, you have to question every video that you see, and videos are often there's a lot of failures that happened right before that video that shot was taken, and so I think the thing that you want to be looking for if you're seeking a solution that is going to be ready to maybe trial at your organization is, where is it really working? And is it really working in a healthcare environment or is it really working in another market and it's coming to healthcare for the first time? Is it working in a research lab and it's time to transition that to practice? And is your organization the right one that wants to be working with a research platform and bring it to practice? Or do you want to be able to go and see those robots running around a hospital and say, okay, I want to do what this hospital has done at my hospital? So dig in and ask for the data, ask for the examples, and you'll see
Mhm.
where what is kind of the stage of development of some of these different products. We're going to see a lot of things come into the market and it's going to be really exciting. There's going to be a lot of opportunity.
And I love your point on this because if your organization doesn't have an innovation council, that really is a good internal opportunity to have different key stakeholders. Super important to have clinicians, nurses, physicians, other disciplines, finance, way back at the beginning involve finance. They're the ones that are going to help make or break your business case. Quality people, IT, informaticist, the more well-rounded you can make this team, I think the more it's going to support your needs and help you as you start to advance that technology into the organization.
That's a really good point, Bonnie. I think one of the things that we've seen about AI and robotics and some of these things that are providing kind of a hospital-wide operational change, it does break down barriers. Like your organization might be used to bringing something in that's just focused on pharmacy or just focused on lab or just for nursing, and I think bringing in most AI and robotics technologies is going to touch all of those groups, and we've found organizations that aren't used to bringing all those groups together to make decisions. It can take a little bit longer. So, pulling that steering committee together can be really important.
Yeah, I think that that's a really good point for us to end on. So, I want you to think about this, Andrea. If you had kind of a last parting thought for people as we really start to look at where is AI going to help us? What's it going to do? How do we separate the hype from the reality on that? What would you leave us with?
So I think I would leave us with the focus, keeping the focus on people and the patient and the mission. That's what we're here to do. And I'm personally very excited about the advances in AI, both in the virtual and physical AI, because there are truly new things coming to market. There are new advances that we're being able to bring into our robots. We're going to see them in other robots and software. But it's the only way those things are going to come into and impact healthcare in the right way is starting with designing the clinical workflow that really works. And so that I think is true of all technology, and this one is no different. It's going to be really exciting, but we have to be careful to keep the patient first.
And I love that point that you left us with because I think to echo your earlier comments, when being in social media world, I would just say that's the opportunity to apply some critical thinking and some filters that really say, is this time for all of us to panic that our jobs are going to be replaced? Or do we really have the opportunity to learn more and understand not only what it means, but how we can get involved in our own organizations? So thank you for keeping the patient the focus of this. That's really why we're all here. So thank you for the reminder.
Absolutely. Awesome. Well, thank you so much, Bonnie. This is great. Always a pleasure to chat through with you. I love, bringing nursing and robotics and AI together. And thanks everyone for joining. We'll, very excited to have had all these wonderful questions, and we'll leave you with that.
Thank you, everyone.